Dr. Kingman, Dr. Torres, we bring you together just to try to summarize where we've been in our discussion. And let's talk about two important aspects as they pertain to patient care: nursing support and lung transplantation. Let's start with you, Dr. Kingman, just a wrap-up of your key points.
Sure. So the Comprehensive Care Center is made up of a multidisciplinary team of experts who are highly experienced with treating pulmonary hypertension, with diagnosing it, very familiar with all the treatment options, and really a multitude of people that it takes to take care of these patients and do it well. The nurse role, as I had mentioned before, is really the backbone of our program. The nurses take care of the patients from the time they see them in clinic, and they address all the issues that come up in between patient visits. They keep us all on track. They notify us when there's things that we need to look into as far as test results and things. So we really couldn't do this without the expert nurses that we have. And then the nurse practitioner role, I think, has been very helpful to us. It allows us to see more patients than what we would be able to otherwise, and really extends the role of the physician. And under their direct supervision, we were able to, I think, make a big contribution to taking care of these patients. One of the things that we do in the nurse practitioner role is manage side effects. Our prostacyclin medications in particular have a side effect profile that can be challenging, and really it requires a lot of working with patients to try to first be proactive and arm patients with ways to manage those side effects, but then also talking to them frequently, evaluating them in clinic very frequently to make sure that things are going well and that they're staying on these therapies that they ultimately can benefit quite a bit from. Also, there's a lot of work done around the whole issue of titration of medications. So the package inserts set out specific guidelines on how to titrate medications, but everybody's different. There's individual patient differences where we may need to slow those titrations or do what we call a stair-step titration, where we might increase the nighttime dose and then wait a while and increase the morning dose. We have a lot of different tricks that we can do when we're titrating and managing side effects to keep people on therapy.
Dr. Torres, some final thoughts from you, sir.
You know, we look at lung transplantation as the safety net for our programs that have advanced lung diseases. For example, in pulmonary hypertension, we don't have a cure for this disease. So we need something to help our patients when their disease is not controlled or managed with medications. We have developed technology like ECMO to help in that transition when patients are too sick and we have to wait for an organ to be available for transplant. And ECMO has been an unbelievable tool that has helped so many patients in our institution to get them through that stage. As an addition to what we do to help our patients, we have noticed that there is a lack of organs available to do transplantation. So we have developed technology like the ex vivo technology to be able to see what organs can be used and increase the donor pool available for our patients. And obviously, lung transplantation is not a cure, but it allows our patients a second breath to be able to stay alive and to have a better quality of life.
So as we sit here, we still wait for a cure. We've talked about what a leading PH center is doing, how it's doing, and what it's doing well. What's next in terms of perhaps looking forward or an area of improvement for patients?
For sure, the ultimate goal is to cure this disease. We have many companies developing newer medications, agents. We have companies also working on improving the technology that gives us organs available for transplantation using pig lungs so that we have unlimited supply of organs, etc. The future is bright. It's not today, but it's there, and we look forward to more things for us to provide to our patients.
Yeah. In the 18 years that we've been doing this, we have seen dramatic improvements. Things are much better today than they were when we started, when we only had one medication, Flolan, right?
Absolutely.
Yeah, so we've seen a lot of improvement, but we agree there's still improvements to be made.
Not only on quality, on life expectancy, but on quality of life. Our patients have much better quality of life than when we started doing pulmonary hypertension way back.
Yeah.
And that's something that the patients appreciate. And I believe that they can see and notice that difference. Today, we're doing a lung transplant, a patient who I met 12 years ago. And the mother of the patient just told me, you remember us in the emergency room? And that's how they started their journey with pulmonary hypertension. And today, he's getting a transplant.
Well, thank you. We appreciate your time. Keep up the passion, keep up the great performance, and thanks for being great hosts and having us here in Texas.
Thank you, Tom.
Thank you.